Hi everyone, this is Dr. Raquel Butler from Integrated Veterinary Therapeutics.
And Sophie Vandenberg from Equine Posture. And we welcome you to the Equine Functional Posture Podcast, your ultimate source for insights into the influence of functional posture on biomechanics, health, and overall well-being of horses.
Whether you're a seasoned equestrian, an equine professional, or simply a horse enthusiast, this podcast is designed to help you understand the critical aspects of functional posture.
Tune in each week as we discuss practical tips, delve into expert interviews, and explore the latest research in the impact of functional posture on equine anatomy, physiology, movement, and more.
Let's create a world where we empower our horses to be in a mental, emotional, and physical balance. Hi everyone, welcome to today's podcast. How are you today, Sophie?
Hi Raquel, I'm going very well. Today's topic is on willy, and we're going to be talking about all things to do with the behaviour of the penis and pelvic comfort. So why are we talking about this specifically?
Yeah, we decided it's a pretty important topic because it's something that we observe in terms of posture. We've probably talked about it before because we've talked about, urination positions and observing your horse just generally with their posture. So, such as how they're standing and what, is considered normal. And so, it's really important that you understand what is normal in terms of like penile function for horses, because there's some misconceptions out there about what it means, and we often do accept things as being normal for our horse, like as opposed to, well, should that really be happening just because it happens every time, we do a certain thing for our horse? Does that mean that that is an appropriate response to that? So I think it's really important information, like what your horse is, obviously we're talking about geldings, but what your horse really does, when, and why. And it really just adds to your powers of observation and recognition of potentially underlying things that you might want to get investigated. Why else do you think it's important for people to recognize their horse's willy behaviors?
Just thinking about the connection into the bigger picture of their body. So the penis, we'll talk about it in this episode, but it's deeply connected through fascia, nerves, through blood supply, lymphatic function. It's something that is linked on a neurotransmitter and hormone level, and it just counts. It adds perspective onto your horse's entire health and the other things that are, going on in their body, and gives us a greater way of considering them as a whole.
Yeah, and I guess understanding, the aspects of function there that are automatic for the horse, and, the other aspects that are kind of consciously related, and that are stress and pain related. So like there's a lot of information that can be gained. And the first story I'd like to share before we're going to jump into signs of dysfunction is Jelly has had a lot of willy issues and dysfunction, which, we'll delve into the why of that. And initially I didn't know what the connections were. Initially it was just like, okay, that's interesting and it's not normal. So things like he would urinate every time after I rode him. So straight away he'd have to urinate, and he'd often urinate as soon as I saddled him up as well. And so you could say, oh, well, like that's just normal for him, because at that time it was something that he did every single time. But over time, as his body and his comfort has improved, it is not something that he does anymore. So now when he does it, I'm like, okay, there's something I need to address. Like I need to check his, we'll talk about like the thoracic lumbosacral function. Like I need to check his function. I need to check his comfort. I need to check why is that happening, because now he'll urinate before he comes in to eat and before he comes into the yard, but he doesn't urinate now with the saddle on ever after I ride him. So that was really important information that at the time I recognized as being a problem, but there were so many potential reasons for him doing that I have had to narrow it down over time. So that's one indication. Do you want to give some examples of signs of dysfunction?
So any time that you're making observations about your horse's penis, it's important to note that it shouldn't always be stuck in one position. Like, you shouldn't always see a penis that is erect or that is always behaving a certain way. So some in particular might be a penis that doesn't come out when it should. So that's coming out of the sheath and hanging out. So when a horse is urinating, they'll allow the penis to drop. Often they'll stretch out and they'll do a wee. If you are getting a horse that doesn't drop the penis out, you've got urine that's on the inside of the sheath, it's very dirty, and that's a really strong indicator that you should definitely be looking into their function and comfort of their bladder, their penis, and then you can also have an instance where
and their spine as well.
And their spine as well, yeah. So the penis can also hang out and be very loose. So there are times that these behaviors might be normal, but if you have a horse who always has that penis hanging out, it's always really loose, it's super flaccid, there's always being in that position is not normal itself. That also counts for if the penis is partway out all the time, if it's stiff. There's also times you might just see them and start noticing and stacking up, okay, there are signs of my horse doing this when we're doing these particular activities, like you were saying. Jelly always wheezes, always used to wee after when you've been riding him. If you find that your horse's penis is always partway out and stiff when you are riding, when you're, out and you see them behaving a certain way while they're grazing, it's just important to take note. Some other things that stand out that people tend to notice because they're obvious are if the penis pulls to one side, both when it is erect or it's flaccid, when they are frequently having an erection. We'll talk a little bit later about why that might happen during times like when you're training. And then other things that may include not just geldings, but stallions, like inappropriate ejaculation and things like that. What would you add?
Yeah, I mean, I've seen a few where it was related to body issues. So I had one last year. He was an off-the-track thoroughbred and he could not stretch out to urinate. So for him, he had a lot of stifle discomfort and quad. He had some damage in his quads. And so the whole time the owner had him, she'd never seen him actually do a full urination. And so his underlying reason for that was pain, and that he couldn't actually stretch himself out and the penis wasn't dropping. He'd just do these little wheeze, and at the end of the first treatment, like, he did a fairly big wee, which I don't think he hadn't been able to do that for at least the months that she'd owned him for, but who knows how long. So that was very abnormal. The other ones I've seen, I had a horse that I treated whose willy was huge, but it was always out and it was always just hanging, and it was actually annoying for him. Like, he would kick at it, and so that is not normal. Like, if your horse is just walking around the pasture and his willy's just dangling away and it's like flapping and hitting his belly and stuff, like, that's a very abnormal behavior that does not signify relaxation, it signifies dysfunction. And so for him, when I investigated further, like, he had a lot of scarring at the base of the penis that wasn't associated with a gelding scar, and I actually suspect he'd had an injury. And that can happen, if they've got their penis out inappropriately and they hit something with it, then they can damage it. And so when I worked on that scar tissue for after the session, he took it in and he stood there. So I treated another horse after him, and then he stood there after that with it in for a long time. And the owner said, like, that's the longest, like, it's not usually in for that long. So, like, that was a significant, like, they're not going to just leave it hanging out. Like, it's a vulnerable piece of tackle. Like, they need to look after it. And they don't want to be exposing that to predators. So they don't just leave it hanging out. Even when they are relaxed, the normal body responses would be for it to be tucked away safely, you know, like there's no reason for it just to be hanging out there even when they are all relaxed. I'm not saying that there aren't horses that do that, but it's not really an appropriate behavior.
Right.
Yeah.
And I just wanted to say, penises, even though there seems to be, there's times when we wash the penis, there are products now, like there's a product called Willy Wash that's, pH neutral and can be used to wash the penis. It's important to consider that they should stay somewhat clean themselves. Dry skin and a lot of smegma shouldn't be building out. So if you have a horse whose penis is very crusty with a lot of dry skin that's always flaking and peeling, if they are the kind of horse that's always getting beans that are building up, often at a dental, the vet will, during a sedation, a lot of vets now routinely check the penis to see if there's a bean in the tip. There's a little fossa there where a lot of smegma can build up and create a little ball. And so I've seen some that are absolutely massive, and I've only ever removed very small ones from my own horses, or a little bit of build up, but there have been huge ones, as big as almost the size of a golf ball, that have been removed from the tip of a penis. That's a huge deposit. So and I also have a horse that I used to have went through an injury where he capped his hip really badly on a power pole that was in the paddock. And he went through a stage of having an utterly disgusting sheath. It was very slimy. It was quite, it was a very clammy, almost wet, slimy buildup of smegma that smelt really bad. And he was itchy. He wanted to scratch it. He would bend over like a little tree in the paddock so that he could stand over it and rub on it. And he in particular is very happy to have it cleaned manually by me. So that's another thing. Some people have horses that know that their horse does or doesn't like to have their penis touched. So for some horses, is it discomfort while they don't like to be touched? Are they quite private, or are they relieved when they can get some comfort from a buildup of crusty tissue in a place that's not easy for them to clean themselves?
Yeah. Well, also when I first got Jelly, so he had a lot of hind end challenges. So, but I can't even remember what made me check. I think he was just stopping a lot. So, like, I was asking him to do, he was learning to do some travers on the ground, and he was just stopping a lot and kind of doing some weird behaviors with his back legs. And so I investigated his sheath, and he had a massive smegma. And initially he was like, don't touch it. Then when he realized that I was actually helpful, he was basically lifting his leg for me and being like, just do it. So the first time I cleaned it out, it was like a handful of, so there was beans in his willy, there was a handful of black muck. It was gross. And I had to do that a couple of times, and then the frequency that I had to do it, as his whole body function and posture improved, the frequency at which I had to do it decreased. So the last time so now he'll ask me to do it. So he literally stops and like stomps and swishes his tail. And then if I still don't get the message, he starts to like point at it with his nose and till I get the message. And so the last time I did it, like he lives without grass because of his muscle condition. So there is a build-up of when it gets hot and sweaty and dirty, he is going to get that. But I've only had to do it twice in the last year, whereas previously to that, I was having to probably do it every couple of months, like check it, and it was always like, it was just yuck. So one of those reasons that could be is because if you've got like tension in the scrotal area, you know, maybe a gelding scar, maybe some other problem in the groin or in the lumbar area, so you've got a lumbar dysfunction, lumbar tension, the lymph nodes that drain the penis are in those areas. And so if there's some reason that those lymph nodes are not functioning optimally, so it could be a local reason, like a physical restriction, it could be a lumbosacral problem where the lymph actually drains into, or it could be a whole body metabolic issue that's affecting the lymphatic system. So you'll often get a build-up in horses with things like Cushing's, insulin resistance, you know, other kind of underlying metabolic issues. So if your horse is constantly building up, you need to consider all of that dysfunction, because once the horses get moving, you address the metabolic issues, you address the lumbosacropelvic dysfunction, it always improves. So I think that's an important one. And now we're going to talk a little bit about like anatomy, just to give you a bit of an idea about, you know, the areas that could cause dysfunction with the willy positioning. So what are some areas that you know, people need to be aware of?
So, I mean, the penis itself, we just talked about the fact that it's allowed to drip out of the sheath, and it'll also pull up. Another function of the penis includes having an erection and then going into, you know, you see when the horse has an erection and they move their penis in kind of like a twitching or a bouncing fashion. All of those are controlled through, you know, fascia and muscles. So there's muscular connections of the penis into the spine and into the pelvis. The erector muscle connects down to the tuber ishii. So that's the point of buttock beside the tail, and also the sacrosciatic ligament. So the sacrosciatic ligament is a ligament that extends through the pelvis area. It goes over the sciatic nerve, it runs up to the sacrum and connects into sort of up in the base of the tail near the anus. The retractor muscle connects to the tail as well, and onto the bottom side of the first few tail vertebrae that actually aren't in the tail, they're just connected at the sacrum, and it may also connect into the last part of the ventral, so the bottom side of the sacrum as well. The scrotal and lumbar lymph nodes you touched on, but in that area, you know, they are responsible for collecting essentially fluid and moving it back through the body, which recirculates and comes around. You know, fluid that leaks out of the circulatory system is then mopped up basically by those lymph nodes and moved on. What other things are you thinking about in that area?
Yeah, so I think, so just like connecting those muscles, so then you've talked about muscle connections to the pelvis, the sacrum, the tail, and the sacroiliac ligament. So just, you know, thinking about those physical connections when you think about the function of the penis, whether it's coming out or going in, and how that could influence it. But the muscles are also innervated by nerves, and so the main nerves come from the lumbosacral plexus. And so if there's any dysfunction within that, the lumbar, the sacrum, also there's some aspects that come from the thoracolumbar area. If there's issues within, you know, caudal thoracic, lumbosacropelvic function, such as a sacral restriction, such as arthritis in the lumbar, such as, lumbar restriction, such as a change in that lumbosacral joint positioning, then that can affect the function of those muscles, just relating to innervation. And so, I'll use Jelly as an example because he has lumbar issues, and I suspect, if we dissected him, that he would have quite significant pathology in his lumbar area, because I know what moves in that area and what doesn't move, and how easily it flares up for him in that area. So, when we think about the control of the willy, we have to think about the innervation and the nerve supply, which also relates to the blood supply. So, there's some osteos that I know very well who talk about treating the blood supply, and how important it is that you've got good blood flow, but how those blood vessels can actually become restricted. So they're surrounded by fascia, they rely on the position of the body to be as balanced and neutral as it can be within itself. And so if you've got a twist or a torsion or a change in angle of a vertebrae of the pelvis, you've got an asymmetry within the body, you've got even a hoof imbalance that leads to a asymmetry in the pelvis, you can have an effect on that blood supply. And so the branches that kind of come out from the main blood supply is the aorta, which goes into the iliac blood supply, which branches to both of the back legs. But if you've got some kind of restriction in there, fascial, vertebral, whole body, then that's going to influence the way that penis functions as well. So we need to kind of consider that.
Those connections. And I was just going to point out what you were saying about the alterations in joint angles, especially the vertebra. Essentially, it's relating posture to pelvic function, which is, the whole idea that, a body in balance and working in an optimal state has good circulation, it has good nervous function, because there's no extreme fascial restrictions or extreme compensation that's creating a decrease in the motion of fluid and blood and lymph throughout the body that causes a stagnation. And in this case, that's a really relevant thing for the penis, because we're talking about a buildup of, when we talk about a dirty penis or things like,
blood supply related, lymphatic related.
Yeah. And just how important posture is there.
Yeah. And then also to understand, actually, I'm just going to talk about the innervation a little bit, because I just want to talk about my own experience. So I have a lumbosacral disc, degeneration. And, I think we can relate this to horses in terms of frequency of urination, and obviously woman versus man. But I've noticed that, so I swim, and that really helps my body. When I started swimming, way back when, my lumbosacral disc was an acute on chronic problem, I couldn't do much without needing to go to the toilet, without needing to urinate, because my nerves were becoming irritated. And so, initially I'd be lucky if I could swim 2 laps of the pool before I needed to urinate. And it wasn't because I drank too much. It was just the nerve irritation on my bladder. And, now I can swim half an hour or longer, and not feel the need to urinate. So it's actually an indication for me when my body is tired, is when I get irritated and I feel like, oh, I need to wee now. I'm like, okay, I'm probably at my limit and my nerves are starting to be irritated, relating to fascial pull or alignment of my spine or my ability to hold my legs up, and so changing the angle. And so I think we can relate that to horses, because geldings are a bit, there's a lot more information, I think, because they have, you know, this complexity of blood supply and innervation and different angles of muscles coming to the penis, you know, so if you have a horse and you've been riding and then they need to wee often throughout the, like I talked about jelly weeing after riding, but if they need to wee fairly often while you're riding them, there's also a sign of a problem, a dysfunction. Whether that's saddle related, whether it's like your riding related, whether it's their dysfunction related, whether it's hoof balance related, there's something in there that's causing, you know, an irritation, dysfunction, pain that makes them need to urinate at that time, because that's not a time that, you know, they're generally going to want to urinate. Obviously, you could have just caught them off guard, got them out of the paddock at the wrong time. They haven't prepared themselves. They didn't hear the memo that they should go and wee now. And so, you know, it can happen, but that should just be a one-off. Whereas if it's happening all the time, that's when you're like, why is this happening?
Absolutely. And if you talking about patterns, can you comment on how central pattern generators are a big part of this system as well?
Yeah, so the process of like ejaculation and you know, the process of mating, I guess, is governed by central pattern generators. Like, it's an automatic response. It's not something that a horse goes, oh, like right now my penis is gonna, you know, whack my belly. Like, that can be an indication that the central pattern generators have been irritated, you know, the input has been changed. And so, like, I've seen it a lot in dogs, you know, where they've had a spinal cord injury and like you get this, you know, kind of, what's the polite word for it? Like you pelvic thrusting motion where like it's an automated response. It's not them thinking, you know, I'm gonna do this right now. And so we can see that in horses. Sometimes during a bodywork session, it'll happen. Obviously during a mating, but you know, you can get it related to excitement or other brain related aspects, or it can be, you know, a spinal cord dysfunction. So if there's been some kind of spinal cord injury, you could get this happening at inappropriate times. And that we do see it a lot in dogs, and I have seen it in horses during a bodywork session where, you know, they'll start the pelvic thrusting and every now and again it'll end in ejaculation, but not always. And so to me, it's like, okay, so why are those central pattern generators being active right now? Like what's going on, you know, spinal cord function wise for this horse? So that's one other aspect that we have to consider and think about.
Absolutely. And yeah, just it's quite a I was just thinking it's quite an interesting moment when I often find that's when they're very deep in, you know, a parasympathetic state that they'll almost, you know, they don't feel especially connected to the environment always, you know, like they're really deep in a self-focused moment when you get that intrinsic thrust of the pelvis underneath your hands or in the body. And I know I've definitely seen it in horses that have gone into a self-focused state in the paddock and they're just resting, whether it's just after body work or in other states. And sometimes you just catch that moment when they're going through it. And obviously the body is able to process things and go through patterns themselves. Like, it's not always in relation to us.
Yeah.
You know, just seeing that moment and being able to recognize that like something is happening inside their body at the time.
Which it's not a normal time for that to happen, you know. So something is changing, something is happening, but it's information that, you know, something was probably out of balance as well for that to happen in an inappropriate kind of time. Like there's something going on there. So I think that probably leads a bit into the bodywork sessions, and we'll come back to you know, other reasons for abnormal penile dysfunction. But you know, in a bodywork session, so people have been known to say, oh, well, like if the penis comes out, the horse is really relaxed. And, you know, I think it's considering that there are other reasons for that, you know, that it doesn't necessarily mean that the horse is relaxed. And, you know, so what kind of things would you consider if you're in a bodywork session? Obviously the penis can come out in different ways, right? Like it could come out and be stiff and pulling to one direction, or it could come out and be like relaxed and floppy, or I've also seen them come out and be pulling backwards, or pulling like really stiff and forwards. So what are, you know, when you see that in a bodywork, and I guess this does relate to abnormal penile function or penile dysfunction, like what kind of things are you thinking about in those situations?
I'm thinking about where I've just been working and, you know, what kind of influences, you know, the body work is having on their body, or my observations about their body have been so far. So that might be simple things such as sometimes an assessment, you know, triggers some kind of cascade in the body, and they'll have a response to being touched in a certain place. So I'll think about where I touch them. I definitely think those things I've been in situations where people say, oh, you know, if you touch him on his sternum, he's going to have a strong reaction. You know, horses who have this mainly geldings, a couple of mares actually that I've
had
seen.
a couple of those too.
I've seen that as well. But just, you know, touching them on their front, they almost have this moment of like a neck rounding response, and having their penis come out often, you know, somewhat stiff. But I'd be thinking predominantly about looking at their, say, all the things that we talked about anatomically. So like tail and sacral vertebra, thinking about the connections up in there, what kind of impact, what kind of posture is the tail in? What does the sacrum look like? Is there tension across there? What do the ligaments around the pelvis and the sacrum feel like? What do the hamstrings and quads feel like? You know, is there roaching of the lumbar? We've done an episode on roaching. Is there issues within the thoracic area? You know, is there evidence through the posture and the look of the body that there's fascial adhesions? You know, things that we talk about in the course, but that we've also talked about in the podcast, particularly in the power of observation. You know, talking about muscle balance and symmetry, tension, and what kind of motion does it have? You know, when the horse isn't actively moving, is there a motion available that shows that there's a level of springiness and elasticity within the muscle, or is it jammed up and hard and tight? Is it over mobile? Is it gripping? Are there lumps and dips and lack of muscle tone or overtone? You know, all these kinds of things that play into throughout the hind end. And I'd also be looking at hind foot balance. You know, what do the angles of the hind feet look like? Is there tension there? And you might be considering the horse's just general posture and stance, and also, do they look comfortable? You know, like there's a link, obviously, that we've just talked about between comfort, discomfort, stress, emotional and affective state that's neurological, it's brain function, etc., that you'd be considering just the whole picture as well as local areas, you know, anatomical connections. What about you? What are you thinking about when you go in and the horse has a willy response?
I'm also just trying to relate it to, you know, can I understand like the physical reactions? Like I know I had one the other day that was out and stiff and pulling to one side. And, you know, so then I'm feeling up in the groin to feel like, can I follow it to the area, like the originating area of where it might be pulling? Like, is there an obvious pelvic restriction or imbalance? And I'm looking for that to normalize at some point, you know, whether that's within that first treatment or whether that's a few treatments down the track, I also want the owner to be aware of it so that they actually start to notice, because they might not have actually noticed. So they might not have been in their level of awareness. So I want them to start to notice that when the horse urinates, is that the position of their willy? You know, does it happen when you're riding them or training them? And you know, I think that leads into the willy coming out in training. And so I've especially seen this in horses that are posturally unfit, and you know, I would say biomechanically unsound, potentially with underlying lameness issue. So, you know, when I've worked with kind of school horses that aren't in regular work, and then we ask them to do something like, you know, lifting the base of the neck and shifting their posture, and after a short time, their willy will come out, sometimes stiff, sometimes floppy, sometimes whatever. But to me, that's an indication to stop. You know, so I'm like, okay, we've gone to their threshold. Whether the threshold is related to like mental emotional stress, or whether it's related to physical pain, or whether it's related to physical restrictions, or whether it's related to physical weakness. And so, you know, we've now worked the muscle, you know, muscles that haven't been working to a point of fatigue, or, you know, tension or brace. You know, it's an indicator, especially when like we're talking about doing stuff when there's no treats involved at this moment, you know, just where, and it's often correlated with, yeah, a big shift in posture, very weak horses, horses with underlying pain, discomfort, and dysfunction, or stress. You know, like what I'm asking them to do is very physically difficult for them. So it might be emotionally difficult, although, you know, they're not showing an obvious emotional dysregulation. However, they are going into like a more of a kind of shutdown state. So you've got that emotional dysregulation, not an outward kind of fight flight response, but more a like, oh, this is really hard, I think I'll just kind of leave. So it's an indication for me from a training perspective to stop what I'm doing and next time to do less, because we've pushed past the body's stress level, physically, emotionally, mentally, however you want to look at it. Okay, so it shouldn't happen in a training session. And that comes back to, if you want to talk about in relation to food rewards in training and how there's been a correlation there with the willy coming out.
Yeah, there's been a couple of studies that have shown that in a training session using food rewards, so positive motivators, that there's an increase in penile tumescence. So coming out of the body with you know, some level of evidence of arousal, whether that's just a slight belling of the end of the penis or there's a little bit of stiffness there. So that, you know, while there's more research needed, it shows that there's a definite link, particularly emotional and emotional regulation. You know, the horse is seeking something, there's a change in their emotional state, but there's a lot there that can be thought of in relation, thought about. So, you know, the context of the session, the horse and the trainer, there's a lot to be interpreted about the reason why a horse is going into or using their penis, and why it's being stimulated emotionally in a training session. So the efficacy of the training can have an influence on the horse's level of stress. There can be, as you were just saying, the horse is being asked to do things beyond their ability, so that can lead into discomfort. The horse might be really anticipating a delicious treat, so, you know, there's pleasure there. There are neurotransmitter relationships, including dopamine, that play in, and, you know, there's no definitive research that we could find really that gives you an exact cause or definition there, because there's just a lot that's wrapped up in many different contexts and a lot of ways to interpret it. But that has been studied. It does happen more commonly with food rewards. So probably some more research is needed there, but there's definitely an emotional link.
Yeah, and I think that when we use food rewards, we have to consider that it can be quite stressful for the horse, because they can become so infatuated on the treat. And so, they're seeking a potential pleasure of the treat, but that can also, create stress because, they've shown it in mice and stuff too, where you have where the treat is not released in a manner that's predictable, that can create stress. So if they don't understand the learning, if they don't understand what they're doing, well, they're just so like obsessed with the treat. And I also relate that back to Jelly, because he used to be like obsessive with treats, and he still absolutely loves them. But now when the treat comes out, he can still stay connected and think about his body and think about what I'm asking him to do. And so, like, I'm trying to remember, but whether his willy used to come out. I know Henry's did used to a lot with treats and doing exercises. And I can't 100% remember with Jelly, but I can say it doesn't now. And if it did, that I would be like, okay, what I've pushed past a threshold somewhere, whether it's relating to him just being so obsessed with the treat, there's a stress threshold there that I've pushed through. And so even if he was like really relaxed and I was hanging out, I'd still be like, okay, I've still pushed through a threshold here. So we just need to consider that, when we are using treats in terms of training, that it can be stressful, and that we still want them to stay connected to their body and still want them to have that ability to emotionally regulate. Otherwise, they actually lose the ability to learn appropriately too.
And especially when you're talking about posture and having an external motivator that doesn't, when we're often doing postural exercises, there's a large aim to create a mental connection to feeling better inside your body, and wanting to feel well. So, and introducing a food reward is a different kind of motivator as well. So, the mental connection with the posture and the comfort is very valuable.
Yeah. So I think that, overall we need to, consider our gelding or stallions willy responses in general, to training, riding, food, urinating, paddock behaviours, bodywork behaviours, all of those things. And we need to recognize what is normal, not necessarily normal for our horse, because sometimes we accept things as being normal for our horse that aren't actually normal, So our horses really should come out when he urinates. They should not be out all the time excessively. They shouldn't be excessively dirty. They should be relatively clean. We shouldn't have to clean them that often. It shouldn't come out, related to training or riding or excessively with body work. Like it's information there that we want to gather and improve over time, and that we need to consider spinal function, fascial function, lumbosacropelvic function, which includes the sacroiliac ligaments. We need to think about the function of the tail and the sacrum. So, it's a intertwined function. It's not, doesn't just mean one thing, but when it's out at inappropriate times, it's a sign of stress, dysfunction, pain, and we need to, try to figure that out. So, anything else you'd like to kind of finish up with there?
Just that, if you go out today, take a moment to have a quick look at your horse's penis, and consider the things that we've talked about.
Yeah, definitely. I think it's an important observation to know for your horse. So yeah, thank you for joining myself, Dr. Raquel Butler and Sophie Vandenberg in today's podcast. Enjoy your horse time. Please subscribe to the Equine Functional Posture Podcast and keep an eye out for our next Equine Functional Posture online course and clinics. And don't miss our weekly episodes. Find the links to our socials in the comments.
And we'll see you in the next exciting episode.